Mast employees are really committed to sickle cell disease because there are a whole bunch of areas that are unaddressed. There's unmet needs, particularly around the organ damage. With MST-188, we're trying to get to the root cause of the disease, to preserve some organ function, to reduce the ischemia so that that pain that's exhibited will be reduced.
MST-188 mechanistically improves microvascular blood flow. So potentially one could look at pathologies where there is decreased blood flow, and the value of MST-188 could be brought to bear.
188 works through a novel biophysical mechanism. It's a rheologic agent. Its primary activity is to block the adhesion of hydrophobic domains. When there's hydrophobic sites, the circulation really, it doesn't flow, it's compromised. That's not a normal physiological condition, and so it sort of restores a more normal physiology.
So we are hoping that all of these properties will translate into the benefit in treating a vaso-occlusive crisis, decreasing ischemia and organ damage. An additional property that MST-188 has is that it enhances the ability of thrombolytics to dissolve areas of occlusion. We're very excited about that because MST-188 in combination with thrombolytics could improve flow in areas of occlusion such as acute limb ischemia.
Another indication that we're considering is acute heart failure. In the setting of heart disease, you can imagine that a drug that can improve flow and be cytoprotective could have a beneficial effect.
It's a huge area of unmet medical need. There are about more than 1 million hospitalizations for acute decompensated heart failure every year, and there are very few treatment options. And MST-188, in at least the early preclinical data that we are seeing, offers the potential to be able to address that unmet medical need.
The work that we're doing today in sickle cell disease is very exciting, and we look forward to getting to the end of this pivotal phase 3 study and possibly getting the drug approved and available to patients. But that's really just the beginning. What sickle cell patients and their families have taught me is to continue the fight. As they continue the fight, advocacy, education, and their battle with their pain, we continue the fight to try to get new therapies and treatments to them.